Welcome back to American Medicine Today. We're going to talk about delaying diagnosis and delivering bad news. I can't imagine that puts any doctor in a good position, but why would a doctor delay diagnosis? It doesn't make sense, or at least to me it doesn't.
You need to divide this in what is the American medicine and what is the rest of the world medicine.
Okay.
It's an example on this article of somebody in Australia, in Sydney, that was treated and they have a delayed diagnosis. Well, delayed diagnosis and delay information of that bad news diagnosis still being called today paternalistic medicine.
That sounds nice, but what is that really?
Paternalistic means the physician knows better. Mm-hmm. And it's true that physician knows better. The only problem is the patient has the right to know what the physician knows.
Correct. But when I was reading, when they described paternalistic medicine, they try to sugarcoat it and say, well, the doctor knows better and they know what's best for the patient. So if they decide not to tell the patient, well, we know that was better for you, and to keep the patient in the dark, how can that possibly be a good thing?
I understand your concept, but you are living in a different country.
Okay.
Okay. And let me explain to you. If you go to Europe or if you go to a socialistic type of medicine, China or Russia, still the paternalistic medicine exists. Mm-hmm. The doctor knows better and is going to inform the person when the doctor feels that it's necessary to inform the bad news. Problem is you cannot adapt that type of a behavior in the United States.
Why not?
Because United States has a total different type of a reaction towards bad news. If you are in the United States and for this type of life, that person had a diagnosis of lung cancer. The doctor will tell you immediately that you have a lung cancer, and depends how he's going to give you the information. Sure. And that is one of the other discussions that they have.
Right.
How to inform the patient. You cannot hide the information to the patient, because if you hide and the person really dies without solving the legal problems or the state situation or an emotional type of solutions of family that they fought, that they don't talk each other, right, and things like that, and then suddenly this happened and they want to get together and talk about.
Yeah.
That situation is absolutely necessary in this country. You have a will, and you need to correct that. You didn't really make your will, but right, you have some estate that you need to give to your children. You need to do that.
Right.
And because of that,
to get their affairs in order.
Yeah, but that's why the bad news is not bad news. It's a news that you need to put you in control to correct the problems that you didn't do at the right time in life.
Right, but this whole subject, quite honestly, bothers me. But they were saying, well, we don't know necessarily that it's always the right time, and we have to be careful how we approach the patient. Maybe they just can't, accept it right now. I don't know how they can make that decision for the patient.
Because they are talking about paternalistic medicine, and they are not talking about American medicine.
Okay, so does that fall under socialistic medicine?
Yes, it's a socialistic approach.
Okay.
The paternalistic medicine still is a behavior of physicians in socialistic medicine.
Sure.
And socialistic medicine, like everything in medicine, is irresponsible. They give a damn about everything.
Right.
So if you have cancer, well, they tell you or they don't tell you,
right,
and that's it.
So what you're saying is, yes, it's socialistic because the doctors don't have accountability. They're supposed to tell you, but if they don't, they're not being held accountable for withholding the information. Am I right?
Yes, you are correct. But let me clarify.
Okay.
The physician doesn't want to give you the bad news. But if he's going to give you the bad news, he's not accountable. And if he doesn't give you the bad news, he's not accountable either. So he has the opportunity to select an easy way for him.
But early treatment could prevent these diseases from getting to a point where they can no longer be treated.
The problem is that he's not going to stop to treat you. The problem is not going to tell you why they are treating you. For example, you're going to have radiotherapy or you're going to have chemotherapy, and but they're not going to tell you why.
But wouldn't an average patient say, hey, why do I need this type of therapy?
Well, in the United States, probably you do that.
Okay.
In other countries,
You don't question the doctor.
you don't question.
Because they're held at such a high esteem.
So you're going to have the treatment because they know they need to treat you,
Right.
but they are not going to tell you why they are treating you. And the world is becoming smaller, 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 so the things are being changed. But still, in a socialistic medicine, the physician has the opportunity to look at himself and say, I'm going to tell you this, or I'm not going to tell you this. And in the United States, I think cannot happen. Not only because that will trigger lawsuits against the doctor. The situation of information is being discussed right now is an ethical factor. They have a group of people that they did some type of an inquest, and they have a large amount, 26% or 30% of students in medicine,
Yes.
residents or in training people. That group didn't know how to give the bad news.
Right, they felt inadequately trained.
Yes, and
Yes.
I understand that because I several times I heard patients that they come over and say, this doctor told the patient that he had cancer and say, you have cancer, you're going to die in 6 months, and he left the room.
Oh, that's horrible.
All right?
Right.
Well, I don't think that can happen, but the patient can feel that happened
Yes.
because they shot him with the news, and then the doctor, after talking to them, left the room,
Right.
and the patient was being left with that situation in their mind.
Correct.
And now he feels that doctor is really incompetent
Yeah.
the way that delivered that news. So it's an ethical fight right now.
Right.
And then they are trying to create an educational, so this type of news will be delivered in compassion mood
Yes.
to the patient.
Correct.
But still, it's bad news.
Yes.
And no matter what, doctors don't want to give you bad news.
Obviously. And there has to be a happy medium between a doctor blurting out terrible information and withholding it from the patient and their families. Make sure you check us out again next week on American Medicine Today.